We're joined now by Dr. Peter Chin Hong. He's a professor of medicine and infectious disease specialist at the University of California, San Francisco. Let's start with this University of Oxford talking about testing the AstraZeneca vaccine on teens, maybe moving to younger kids. What do you think of that idea?
I think it's a great idea, actually, because I think we need all hands on deck. We certainly don't have enough doses of any vaccine for the people who need it the most now. And I think having that data would be important as policymakers move into all segments of society to have the vaccine available.
And Dr. Chin Hong, we heard this story from Israel where hospitals are being told to brace for an increase in COVID infections in kids. How alarming is this?
So the data we have so far is showing that there is actually not serious illness that's additional with the variants that we have on board. We know the most about the B.1.1.7 UK variant, and at least studies from King's College in London suggest that there are actually fewer kids going to the ICUs when you look at the variant compared to the traditional COVID back in March to May of 2020.
And Doctor, the New York Times had this story out with a headline, COVID-linked syndrome in children is growing. Cases are more severe. In the story, the doctor talked about a higher percentage of children who are really becoming critically ill. For the longest time, it didn't look like kids were, they weren't immune, but they were also less likely to have severe symptoms. What do you make of this development?
Well, I think there might be some bias in terms of reporting, because as recognition increased, we're seeing more of these cases that were before this sort of mysterious, because some of these are COVID negative, and they're coming to the forefront of being notched in with COVID. That's one thing. The second issue is, of course, if you have a huge countrywide surge, as we've had in the United States, you're going to find, statistically speaking, numerically more kids who are seriously ill, but the proportion of kids still remain very low.
That's a really good point, because we saw this enormous surge. There's also still this debate about opening schools, getting kids back into the classroom. If parents are reading these kinds of headlines, hearing these kinds of stories, they may want policymakers to rethink that idea. What would you say to them?
Well, I would say that, in the early part of the pandemic, we didn't really know or have as much data, but now we actually have data that it's safe to open schools. We have two recent studies, one in Science, showing that most of the transmissions in the US is still really, really low if you're 9 and under, and as in 2% versus 50% in the above 20 to 50-year-olds, or 50 to 75%. The second study, I think, is even more compelling. They looked at Wisconsin, the surge of COVID in the summer, and found 0 transmissions of teachers linked to school outbreaks. So I think both of these give us some evidence that if you have a good plan, you're not going to see a lot of intra-school transmissions, particularly in kids who don't have a lot of risk numerically, percentage speaking, compared to adults.
Doctor, I was speaking with an expert last week who said this is really a battle of the strongest strains of the virus, that the mutating is going to continue. We'll really need to accelerate the vaccinations, because we're looking at the potential that each new variant is going to be more difficult to deal with, perhaps scarier, more contagious. Is that how you see it? How nervous should we be about these variants that keep propping up?
We should be generally nervous, just because the more people are transmitting virus, the more chances the virus has to mutate. We know that the virus mutates at least once every 2 weeks. But what's happening now is kind of an interesting evolutionary feat, which is something called convergent evolution, where the thing that's been selected for in these variants is the aspect of the virus that makes it survive longer, which is a mutation in the spike protein to allow easier entry into the doorway of the human, so to speak.
Interesting. Dr. Peter Chin Hong joining us from San Francisco. Thanks so much.
Thanks so much, Mike.